Hello, my name is Andrea Bound, and I'm doing my presentation on late adulthood and sexuality and sexual health. This is for my human behavior and the social environment class with Dr. Perkins for Social Work 506, Section 601. So, the stage of late adulthood is the last stage of human development. It spans from the age of 65 until the end of one's life. It's the longest stage of development as it can cover 1/4 to 1/3 of an individual's life. And our textbook goes even further to break this into 3 stages of the young old, the middle old, and the oldest old. The stage of late adulthood is growing due to the improvement of healthcare availability and technology and treatment options. It's expected that the cohort is going to outnumber the children of the age of 5 and 14 by 2050. This aging of our society can bring about significant changes to economic and social conditions. As with all other developmental stages, late adulthood is marked by significant transitions that individuals must respond and cope with. Among such of them are the deterioration of one's physical health and cognitive functioning, adjusting to new social roles in the community and one's family, reviewing one's life in the search of personal meaning or reminiscence, and coping with loss, and even preparing for the end of one's life. So, as with all of the other stages, late adulthood is characterized by physical, psychological, and social changes. Although we experience aging throughout our lifespan, in the stage of late adulthood, individuals begin to see the decline in their ability to function, though this can vary from individual to individual. Aging has an effect on all the physiological systems, like our nervous system, our cardiovascular system, respiratory system, and sensory systems, just to name a few. And such changes result in the decline of one's health. And in that, individuals can begin to suffer from many chronic health conditions, such as cardiovascular disease, diabetes, arthritis, stroke, kidney disease, Alzheimer's disease, and dementia, just to name a few. Additionally, individuals, if they already haven't, can develop a disability, which can significantly interfere with their ability to perform activities of daily life. Although this also varies from individual to individual, it's expected that each person who reaches very late adulthood will at least need some assistance with completing one activity of daily life. Older adults also experience many psychological changes, and these can occur in personality, mental health, or cognitive functioning. Personality refers to individual differences in characteristics of patterns of behaving, feeling, and thinking. Personality changes are subject to a number of contextual and developmental influences across the lifespan, and these can differ between cultures and individuals. Fortunately, most research has proposed that personality changes in late adulthood remain stable and positive. Older adults typically have lower levels of neuroticism, meaning less moodiness, less anxiety, less anger, hostility, worry, and fear, and they experience significant increases in agreeableness and conscientiousness. Older adults have been shown to exhibit outgoingness, self-confidence, warmth, and view change very positively. However, this can be significantly impacted by life tasks, events, and transitions, which can have varying effects on individuals' personalities. Unfortunately, there can be times where older adults experience significant personality changes, but research largely attributes this to the manifestation of a neurodegenerative disease, such as dementia or Alzheimer's. Similarly, the mental health of older adults is typically identified as positive. However, this can also vary from individual to individual. Positive mental health in older adults is often associated with self-positive reminiscence, which means that they reflect on positive memories that they've undergone during their life. And this helps to cultivate a sense of identity, greater life satisfaction, greater purpose in life, and even the acceptance of the end of their life. On the other hand, individuals can experience significant shifts in mental health. This has been attributed to self-negative reminiscence, where individuals tend to relive difficult memories, or they continue to evoke the memories of those who they've lost. And this is associated with higher probabilities of mental health problems in older adults. And lastly, older adults can experience changes in their cognitive function, and this can include changes in their ability to speak, changes in memory, learning, attention, and even executive functioning. Those in late adulthood also undergo significant social changes, because as they transition into late adulthood, they can lose many social roles, and therefore they may have to redefine their identities and continuing roles within the family and community. Older adults are often relieved of their primary roles within the family and often fulfill a supporting role for the older and younger generations. In some cases, older adults may gain the role of a caregiver for their spouse or grandchildren. Additionally, individuals undergo retirement at this stage, so they lose a significant piece of their identity and social network during this change. However, research indicates that individuals tend to transition through this by adopting new roles in volunteer positions or part-time roles. On the most negative side, individuals in late adulthood often have to cope with the death of a spouse. And navigating newfound singlehood can have a significant impact on their physical and mental health. And families will oftentimes have to reconfigure themselves to help with the grieving process that the older individual may be going through. Also, older adults tend to transition into the role of a care receiver during late adulthood, and this involves the loss of independence, which can be a significant stressor not only on the individual but that of the family. And this is significant because most oftentimes family members are more likely to be caregivers to their parents that are in late adulthood. But in some cases, older adults may experience institutionalization, and in that they have to transition into long-term care facilities. And this often leads to the stressors of adapting to new environments and a new community. So, to begin speaking on sexuality and sexual health in late adulthood, I feel that I should begin by defining the terms. So, sexuality refers to one's partnership, preferences, sexual activity, functioning, behaviors, and attitudes. And sexual health refers to a state of physical, mental, emotional, and social well-being related to sexuality. Sexual health and sexuality is important in the older adult population because because older adults continue to engage in intimate and sexual activities well into very late adulthood. Although sexual activity has been identified to decline in older age, and this is due to a variety of biological changes and chronic diseases, sexuality continues to be an integral part of life for older adults. Research has consistently showed that sexuality in late adulthood contributes to the health and well-being of older adults. Though this does not come without concerns, because for one, there's a significant amount of there is a limited amount of sexual health services for older adults, and oftentimes there is a communication barrier between older adults and their physicians. Healthcare providers, including psychiatrists, infrequently ask older patients about their sexuality or sexual histories, and thereby overlook critical health-related data and miss opportunities to address issues that can enhance their patients' health and well-being. Also, physicians are less likely to test older adults for sexually transmitted infections such as HIV and AIDS, because symptoms can often mirror those that are traditionally thought of as aging. And because of this, such STIs or diseases often go underdiagnosed. Therefore, it's no surprise that the older population is one of the fastest growing cohorts in terms of contracted STIs and HIV and AIDS. New HIV and AIDS diagnosis among people over 55 years old have almost doubled since 1999. This raises serious concerns as it can have significant economic, social, and health-related costs, and this also significantly affects the health and well-being of the older adult population. So, to speak on some of these influences, one of the most predominant influences is the provision of ageism. Ageist attitudes and our society's focus on youthfulness contribute to stereotypes and beliefs regarding sexuality among the older adult population. Seeking treatment for sexual health is often inhibited by internalized stigma and embarrassment of older adults. They see it as a normal part of aging to lose their sexual health and sexuality in light of our society's view on beauty and youthfulness. And unfortunately, doctors' attitudes often mirror this stereotype, and they often believe that older adults are asexual, and this can create significant barriers between healthcare providers and older adults during consultations, which can be very critical to their overall health and well-being. And to further this, when older adults become residents of long-term care facilities, they often face barriers to sexual expression because ageist ideals bring negative views towards their expression. And lastly, ageist ideas influence policies and programs directed towards older adults. And oftentimes, these ageist attitudes significantly impact the educational programs that are directed towards older adults. Also, a significant impact on sexual health and sexuality of older adults is culture, as culture helps to define what people believe, how they behave, how they communicate, and how their identity is formed. And this even includes sexuality, because it's a very internalized and socially constructed process. For example, Hispanics may feel uncomfortable seeking help due to violating the ideals of machismo and Marianismo. And even in Asian cultures, older adults, they're very reserved when it comes to speaking about their sexual beliefs and behaviors. And this can cause a serious disconnect between physicians and Asian Americans or Asian cultures in general, because this can affect their ability or wantingness to seek sexual health advice or sexual counseling. To even further this, to go into the culture of the LGBT community, older adults in the LGBT community have spent years hiding their sexuality, and seeking assistance for sexual health needs can be a great source of shame, which can limit them to actually seek help. Also, if we consider that of African Americans, you have to consider the compounding effects of discrimination, which can leave them with limited access to educational opportunities regarding sexual health and risky sexual behaviors. Though it is clear, very clear, that there is much research to be done regarding cultural influences on the sexuality and sexual health preferences of older adults. Additionally, older adults who are institutionalized may face barriers to sexual expression, and this can definitely come in the form of the physical environment. Long-term care facilities can inhibit sexual expression among residents, and this is often because staff in long-term care facilities often respond to resident sexual behavior with negative attitudes, and such behaviors are labeled as problematic. To even further this, family members have considerable influence in these environments and can often intervene. So this brings into the idea that individuals lose privacy, and also they face significant barriers to expressing themselves sexually in older adulthood. Though the long-term care facilities here are strikingly different from those in Denmark because they allow conjugal visits, which I think is pretty awesome. And also, we have to consider, in terms of our physical environment, cultures such as Hispanic cultures and Asian cultures. When one reaches old age, they may begin to reside with extended family, or they've already been residing with extended family. And then they continue to face significant challenges in expressing their sexuality because of the proximity between themselves and their families. Fortunately, we do have some strengths when it comes to promoting sexual health and sexuality among our older population. So, because our society is aging and it's expected to become one of the largest cohorts, health directives, policies, and attitudes towards older adult sexual health and sexual education and sexuality are all changing. And as many programs are being implemented to be directed towards older adults. And one such program that I found really interesting and a strength is the program of the National Long-Term Care Ombudsman Program, which seeks to normalize sexuality within institutional settings. And I feel this is very important because individuals in long-term care facilities, they often face many additional barriers, and one of the most promising points of being in a long-term care facility is privacy. And this program seeks to enhance individuals' right to live their lives while in there, including sexual expression. So, when dealing with sexual health in late adulthood, there are many ethical issues and practitioner dilemmas that can arise. First is the informed consent among cognitively impaired clients. Social workers are primarily focused on promoting the well-being of clients and respect and promote the client's rights to self-determination. And this can be found in the NASW Code of Ethics 1.03 for informed consent and 1.02 for self-determination. However, in some cases, older adults who have dementia or other cognitive disabilities, informed consent may be a difficult area to navigate. In such instances where the client lacks the capacity to make informed consent, social workers must seek counsel, but also they should seek permission from an appropriate third party, if all else, that has the client's best interest in mind. Also, a significant ethical issue would be the ethical value of privacy and confidentiality, which can be found in the NASW Code of Ethics 1.07. And this is in stark contrast to state law and the commitment to clients, which can also be found in the NASW Code of Ethics at 1.01. And this involves the confidentiality breach regarding HIV/AIDS risks of transmission to others. So social workers should protect the confidentiality of all information obtained in the course of their professional service. However, the exception to this is when disclosure is necessary to prevent serious, foreseeable, and imminent threat of harm to oneself or another. And this can be in the case of a flagrant disregard of North Carolina state law and regarding activities and issues that may arise when individuals flagrantly disobey the law regarding HIV and AIDS. It's stated in state law that providers must disclose information to the local health director for investigation if individuals are not following the prescribed laws when being diagnosed with HIV and AIDS. That poses a significant risk of transmission. Lastly is personal bias. When dealing with older adulthood and sexuality and sexual health, it's a touchy subject that can be fraught with personal biases, which can have the potential to influence practice. So it's important that social workers understand and evaluate their own beliefs regarding sexuality in later life, because their inability to do so directly goes against the NASW values of service, dignity and worth of the person, and integrity. And the NASW Code of Ethics specifically states that social workers must elevate services to others above self-interest. We must treat individuals in a caring and respectful fashion, and we must maintain the profession's missions and values, despite our own beliefs. So, in summary, sexuality and sexual health contributes to the health and well-being of older adults. And this is significant because as a social worker, our goal is to improve the well-being of every individual we come into contact with. But to even further the relevance of this, is there are so many opportunities and relevancies for practice, because there are so many areas to improve, like implementing sexuality and sexual health programs and services for older adults, because there's a significant disparity among them and those of younger adults. There's areas to advocate for policy and education. There's areas to educate practitioners on the specific needs of the older population so they can speak and get health care that they need. Also, there's a significant need to contribute to research regarding cultural influences in sexual health and treatment services among older adults. There's so much to do in just this concept, and I think it's highly relevant. And so that's it, folks. Thank you so much.